Hi, I'm Samantha, and this is my wound video. So I'm going to check my doctor's order, come into the patient room, provide privacy, do my hand hygiene, ID the patient, my two methods, assess the need for pain medication, pharmacological. We would have given something 30 to 60 minutes prior to the dressing change, and also assess for non-pharmacological pain measures we need to take. So I have my bed raised to a good working height, and then I'm going to uncover the patient, only uncovering what's necessary for the procedure. And I'm going to place this over here to keep the bed dry and clean. And place my trash receptacle nearby. So then I'm going to put on clean gloves, which actually, Aaron, could you hand me a pair? Because I don't have any. Thank you, dear. Put on my clean gloves, and I am going to remove the old dressing.
You wouldn't want to go over, exactly. Maybe you actually might do a 5/8.
I would untape each corner of the ABD. I'm going to pull it up from each corner, grab it, and throw it away. Remove the gauze, throw that away, and then remove the packing. And when I do assess the drainage, which this is a moderate amount of purulent drainage, also throw that away. Then I'm going to assess and measure the wound. So I want to assess the skin around the wound, noting what it looks like in the color. So it's a little pink around the wound. And I'd also be checking for any granulation tissue, eschar, necrotic tissue, things of that nature. So then I'm going to grab my measuring paper and some Q-tips. Open those.
If you work in an allergy clinic, we're only going to be doing TVs,
So then I want to measure the longest point from top to bottom.
So that one I mentally separate from sub-QIM. It's not exact.
Pardon me.
It's only really big.
And making sure when I'm measuring it not to actually touch the wound.
I don't think it's going to be.
Actually, that's not the side I want.
So I'm doing sub-Q, and I'm getting
So from top to bottom, it looks to be about
Q I do in the back.
6.4 centimeters. And across
So the tricep,
about 5.1 centimeters at the longest points.
I mean, I wouldn't be saying in the tricep.
So now I'm going to take a Q-tip and measure any tunneling throughout the wound.
So, I mean, if you're trying to describe this.
Put it in as far as it goes, mark with my finger, and then hold up and measure.
the sub-Q area,
Above.
That spot's about 1 centimeter.
but superficial to the,
Right, yeah.
At about, the 1 centimeter was at about 3 o'clock.
triceps. So either there, or I can do it in the abdominal area, 2 inches.
Then we have about 1.3 centimeters, about 5 o'clock.
Yeah, they mean a natural belt line,
So,
around the umbilicus.
around the
It's,
umbilical. So 2 inches basically around the around
About
the
0.5 centimeters, 6 o'clock, and then you just continue going around and measure
where there's
any tunneling.
Okay, and then, isn't there's more, oh yes, back here.
And about 1 centimeter at 11 o'clock. Once you have that all done and measured and assess the area around it, you're going to discard of all that, take off your clean gloves, throw them away, and set up your sterile field.
So there's 5 parts for the sub-Q.
8, 1, 2,
Oh, I mean,
4, 5, 6.
Okay, so first we're going to open our sterile drape.
for substitute. And then for IM, it's.
Flip that open.
It's to 1.5, and then for the intradermal, it's, is it 1/4 to 3/8?
Hopefully not get it stuck.
You're not even inserting that needle on there.
Okay, so I want 0.4.
There we go. Next, I'm going to bring over all my other supplies. I'm going to open our basin.
Any recommendations? Oh, using a chainsaw. That's like kind of harder.
Move this stuff right here.
As long as it's at the top, you're fine. Oh, and you push the rest of it out. Oh, okay.
But there's still, so there's stuff there, but there's an air bubble there.
Even though you're pushing some liquid out.
And we would obviously be using a new ABD and checking that none of these things were expired.
And I think it's a little different.
We're going to need a couple gauze
Liquid in ours because we're reusing them.
on our drape and a few
If you
in our basin as well.
you are injecting air, turning it upside down, you're not getting all of that liquid out. There's still air. So I think that's.
You want to open all of things away from you. Drop them where they need to be.
Rolling out. Let's see, what else is looking at down there? There it goes. That's pretty good. Now, when I do this, I'm not gonna use Z.
I'm going to come over and get my saline. Make sure that it's not expired.
I've done this.
Open it up, place the cap face up, come over and pour it into my basin,
And it's not necessarily on.
and recap it,
That's what the 2x4 is.
put it away.
2x4.
Gonna grab my pair of sterile gloves, open those,
Right. Wait, how long do you do it with alcohol gloves?
slide them over here, put them on.
Watch it.
First one we're gonna grab on the inside, pull away, and put on, keeping our hands above our waist.
And the angle can be.
And then the next one, gonna grab out,
Okay, to go 90, right? That's what I usually do.
Yep, and I have to say I usually do too.
keep our hands above our waist, and
The person.
put that one on.
Okay, so we've done.
Once we have our sterile gloves on, then we're gonna come over and first thing we want to do is clean out our wound. So we're gonna grab our Q-tips and we can place them in the basin. And we want to grab one out and clean the wound going from the center outward in a rolling motion. We're only going to use each Q-tip once, so we would throw that one away. Grab a new one, do the same thing, clean the wound from the center out. We'd throw that one away, grab a new one. For purposes of the video, I'm going to use the same one. Roll from the center outward, throw that one away, and we would continue that process until we have cleaned the entire wound. Next thing we want to do is take a gauze and dry the wound. So we're going to take it and just blot it gently dry. Throw that away. Take another one, blot it dry again, and we'd also repeat that as many times as necessary till the wound was dry.
Oh, 5 units.
So next thing we're going to do is pack the wound with the moistened saline gauze. I would have a fresh, sterile Q-tip.
5 units.
for this procedure. And I want to take one of these out
What does it stand for?
and just fluff it.
No, that's the name of
Open it up as much as I can
So they just missed the,
It's gotta be.
to then pack it into the wound.
In fact, it's usually.
Then I'm going to take my Q-tip,
5 is awfully small.
kind of put it on the outside there,
The size of the wheel,
and then place it into the wound
then. An even phone.
and push it along all the edges, making sure we're getting underneath the tunneling.
I stretched a little bit, but I got
We don't want to overpack the wound too high, and we don't want it to touch any of the skin or too much of the outer edge of the wound. We don't want it coming out of the wound. Then I'm going to grab another one, wring it out so it's not too wet. Fluff it open, and we're going to do the same thing. A wound this size, and judging by how much I took out, it looks like we're only going to need about 2 gauze to pack it. So on my last one, I kind of want to twist up a little tail, and we're going to leave that out at the end so the next person who has to change it has something to grab onto when they want to remove this and change the dressing again. So we're going to once again pack this into the wound underneath any tunneling, making sure we're being as gentle as possible around those edges.
Okay, so,
We want the packing to be flush with the wound, not sticking out above it, and not enough where it's not packed and flush with the skin. So then we're going to leave our little tail just kind of sticking up so it's easily removed next time. I'm going to throw that away. Come and grab my gauze and place that over the wound. We need 2 layers for to wick any drainage. We're going to place both of those on there. Then we're going to grab the ABD. At this point, I would label it with my initials, time and date for when I did the dressing change. We want to label it right now because we don't want to write on top of our patient. So then we're going to open it, not touching the inside at all, and place that over the patient as well. And then I would tape the 4 sides there to hold that down. Then I'm going to clean up all of my stuff, throw it all in the garbage, dispose of all of that, remove our pad, take off my gloves, throw those away. And I want to put my patient back in a comfortable position. Patient stated they were comfortable laying on their stomach, so I'm just going to cover them up so they're not exposed. Lower the bed back into the lowest position in order to be safe. And then I'm going to put the side rails up. Well, if I could, but this bed is moved too close to this table. It's stuck. I would put the bed rail up. Make sure my patient was comfortable, had call light in reach. Do my hand hygiene. And that is it for my wounds.